Okay. Good evening. Good evening, everyone. Today we will be discussing questions of week number 7. We have already discussed previous year questions, assignment questions of 6 weeks before, and who have been joining the sessions continuously. They have an idea about it. If someone is new to the class today, let me introduce myself again. I am Amrita, a PhD scholar at University of Hyderabad, and I take these live interactive sessions for practicing the previous year assignment questions of the course Maternal Infant Young Child Nutrition, whose lectures are taken by the course instructor Professor Rupal Dalal ma'am. So I hope you all are attending the lectures and are able to understand the lectures properly. And it is very important to attend the that respective week's lecture and then join this session so that we can have an interactive session here, and whatever questions we will be discussing, you people can answer that easily, right? This session is for your practice, to practice the number of questions that can come through this course in your exams, right? So today we have a lot of questions. I think around 44 questions we have today. It is a huge number for the one session. So we'll try to finish it, and we'll pace up a little bit high, and we'll try to finish it within time. Okay, so the questions are very easy. There is no need to panic, and very direct questions. I don't think you people need explanation for each and every question. Whichever questions requires explanation, I think I have included in my PPT. And whoever has doubt for the question which I didn't include any explanation, please you can ask me in the chat box, and if I know, I will definitely answer it. I'll try to explain it in a more elaborate way. Okay, so we'll start. I hope everyone knows the drill. We will, I will show you the question. I hope you all are able to see the screen, see the first slide, as well as my audio is clear. I am hoping that. So I'll show you the question. I'll give you 1 to 2 minutes time. You people need to answer your correct choice in the chat box. I'm repeating, in the chat box. Don't unmute your audios or videos. Okay, we'll interact through the chat box. I am continuously watching the chat box. Okay, and please keep a track of how many questions are there. I think I've deleted some questions in between because they were repetitive questions of the previous weeks, and still after deleting 4 5 questions, the number is still 44, I think so. So out of 43 or 44 questions, whatever it is, let's see how many marks you score. Today it's a huge number. Okay. So we'll be going at a little faster rate compared to the previous session. So I hope you people don't mind it. Anywhere anyone has doubts, they are free to question it in the chat box. Okay, we'll clear it out. Okay. So we'll start with our first question today. Ready? Okay. Which body parts help breast milk flow freely after massage? Neck and shoulders, neck and lower back, neck and upper back, neck and stomach. Everyone, please be active throughout the class and try to answer. And please just don't see the presentation and not even try to answer. Right? Everyone, please try and answer. Okay? Even if it's wrong, it's okay. You will know the correct answer to it. This is just a practice session. If you do well here, definitely you will be doing well in your exams. Okay. Okay, let's see what is the correct answer to this question. Correct answer is C. I think maximum people have given the correct answer. If you give a massage on the neck and upper back of the mother, it will help in the flow of the breast milk. It will make it more easier and free, right? Okay. We move to the next question. Which hormone encourages the let down reflex? Which hormone encourages the let down reflex? Prolactin, oxytocin, testosterone, or progesterone? Start answering. Okay, let's see what is the correct answer to this question. Yes, the oxytocin is the hormone which encourages the let down reflex. So, this is a new term. What is a let down reflex? The oxytocin reflex is also known as the let down reflex or the milk ejection reflex. What it is? It is the milk ejection reflex. So, as the term says itself, like it is for the it is for letting out the milk out of the breast. So that function is done by oxytocin. So oxytocin is produced more quickly than prolactin, right? So it makes the milk that is already in the breast flow for the current feed. So oxytocin functions in taking out the milk as the baby is sucking the breast, right? So it is helping in the baby to do the current feeding and helps the baby to get the milk easily. That is known as the let down reflex, which is done by oxytocin. Okay, we'll move on to the next question. Fat rich milk is present in which part of the breast? Front, back, left, or right? Start answering. Okay, well, let's see. B. Okay, let's see what is the correct answer to this question. Yes, B. Back. Fat-rich milk is present in which part of the breast? On the back part of the breast. So, we have already discussed in the previous sessions what is hind milk, what is fore milk. So, hind milk is the milk that follows the fore milk. That is, fore milk is the thin milk and hind milk is the thick wala milk, right? So typically at the end of feeding, and it is highly fatty. So hint milk is highly fatty in nature, and it usually takes 10 to 15 minutes for your baby to get through the first milk, and as your breast empties, as the breast milk starts emptying down, the milk flows slowly and becomes richer in fat. So the back milk is rich in fat. Okay, we'll move on to the next question. Why is massaging of the breast before breastfeeding important? It helps to open the milk ducts, it ensures the baby to attach deeply, it makes the mother's areola softer, it helps mother with flat nipples. Start answering. Read the question properly and think and answer. Okay, let's see what is the correct answer to this question. Correct answer is A, not C. I think one person has given the correct answer, right? So, massaging the breast before breastfeeding helps in opening the milk ducts, which leads to easier flow of the milk, right? When the milk ducts open, we discussed in the first question, right, that massaging of the breast in the upper back area and the neck leads to better flow of the breast, that is opening of the milk ducts, right? Not C. Okay, we'll move on to the next question. What helps the baby to open the mouth widely? Mimicking actions like eating and laughing, tickling the baby's feet, rubbing the nipple on the upper lip of the baby, tickling the baby's back. This is what helps the baby to open the mouth widely for breastfeeding, right? Okay, I hope you got the question. Start answering. Okay, okay, Swati ma'am, I'll check it. But yeah, according to the system generated answer given by Rupal ma'am, it is A. I'll check it with ma'am once. Yeah. Okay, let's see what is the correct answer to this question. C. I think everyone is correct. Rubbing the nipple on the upper lip of the baby helps the baby or urges the baby to open the mouth widely for breastfeeding. Okay? Okay. We'll move on to the next question. Which hormone is produced at a higher level during the night in a lactating mother? Oxytocin, prolactin, progesterone, or aldosterone? Start answering. Okay. Let's see what is the correct answer to this question. Correct answer is B, prolactin, right? I think everyone has given the correct answer. More prolactin is produced at night, so breastfeeding at night is especially helpful for keeping up the milk supply, right? Prolactin seems to make a mother feel relaxed and sleepy, so she usually rests well even if the breast feeds at night. So prolactin is a very important hormone playing its role at night for lactating mothers. Right. Okay. What is hand expression of breast milk? Manual removal of breast milk using hands, massaging of breasts using hands, warm compression of breast using hands, extracting breast milk with a hand pump. Okay, let's see what is the correct answer to this question. I think everyone has answered it. It is A. Right? Manual removal of breast milk using hands is called as hand expression of breast milk. Here you can see, position your hand on your breast in the C fold. This is the C fold. Hold a clean collection cup under your breast with your other hand, right? And then begin to gently push up your breast back towards the chest wall with your thumb and fingers. Like where you can remove the breast milk using your hands, and this is known as hand expression for breast milk, right? Okay, we'll move on to the next question. What can the mother put in the baby's nostrils to clear dry mucus before breastfeeding? Coconut oil, castor oil, water, or nasal saline drops? Okay, let's see what is the correct answer to this question. D. Nasal saline drops. I think everyone has given the correct answer. So, nasal saline drops or the saline solution is the only nasal spray or drops which is considered safe for babies, infants, or toddlers. So, how to use the saline drops? You lay down your baby on their back and, if possibly, slightly tilt their head back. Don't force it, and then spray 2 to 3 drops of saline spray into each nostril, or if it is a drop, then you can use 2 to 3 drops. That way, you can clear the dry mucus in your baby's nostrils before breastfeeding. Okay? Okay. We'll move on to the next question. Which hormone level does not rise because of a remaining piece of the placenta in the mother? Oxytocin, prolactin, progesterone, aldosterone. Okay, let's see what is the correct answer to this question. Correct answer is B. Prolactin is the hormone with due to it doesn't rise due to because of the remaining placenta in the mother. Right? Placenta controls the prolactin levels in the mother. Okay. We'll move on to the next question. Is it safe for the mother to continue breastfeeding when she is pregnant? Yes, no. Depends on the weight of the first baby, depends on the mother's diet. Okay, let's see what is the correct answer to this question. It is yes. Yes, it is definitely safe for the mother to continue breastfeeding even when she is pregnant for the second time. Okay. Okay, we'll move on to the next question. What other foods and fluids can be given to a baby under 6 months of age? Fruit juice, rice water, formula, nothing except breast milk. I think everyone knows this answer. We have discussed this topic a lot of times previously. Yes, I think everyone is giving the correct answer. The correct answer is nothing except breast milk, right? For the first 6 months, the baby needs exclusive breastfeeding and nothing else. So the correct answer is D. Okay, we'll move on to the next question. How many times should the baby be breastfed at night? Once, twice, 3 to 4 times, or baby should not be breastfed at night? Okay, let's see what is the correct answer to this question. The correct answer is C, 3 to 4 times. Usually, 3 to 4 times the baby should be breastfed at night. Okay? Okay, we'll move on to the next question. Which of the following is a baby's fullness sign? Crying, closing mouth, sucking fingers, turning head from side to side. I hope everyone present in the session are answering each and every question. That is only for your own benefit, right? Okay, let's see what is the correct answer to this question. The correct answer is closing the mouth. Closing the mouth, when the baby closes its mouth, it shows that it is full now, it is not hungry anymore. It is, he is satisfied, he or she is satisfied now, right? Rest options like crying, sucking fingers, both of these are indications that the baby is hungry, right? Closing mouth is an indication that the baby is full now. Okay, we'll move to the next question. Mother complains about reduced breast milk supply. What could be a possible reason among the following? Poor latching or nipple feeding, deep latching, small breast size, not using a nipple shield. Done? Okay, let's see what is the correct answer to this question. The correct answer is A. Poor latching or nipple feeding is the reason that it could lead to reduced breast milk supply by the mother, right? Okay. We'll move on to the next question. During breastfeeding, mother expresses milk and thin milk comes out. What should the mother do? Stop breastfeeding, continue feeding from the same breast, offer the other breast to the baby, express the thin milk completely before breastfeeding again. We have discussed about this point before. I hope everyone knows what should be the correct answer, right? Okay, let's see what is the correct answer to this question. Correct answer is B. Continue feeding from the same breast because after the thin milk, the thick milk will start coming out. So if you change the from one breast to another, it will not be good for the baby because the baby needs thin milk, that is the fore milk, as well as the fat milk, that is the hint milk, for proper nutrition and growth, right? Okay. We'll move on to next question. New mother is having trouble with attaching the baby deeply to her breast and getting more milk by day 3 of birth. What could be a possible reason among the following? Breastfeeding was not started within an hour of birth. Mother has big breasts. Mother is not talking to the baby. Baby is not hungry. Okay, let's see what is the correct answer to this question. The correct answer is A. Breastfeeding was not started within an hour of the birth. That's why the new mother is having trouble with attaching the baby deeply to her breast. Because why? What is the reason? We'll discuss in the next few questions. Okay? Okay. When is side-lying hold for breastfeeding recommended? When the mother has twin babies, when the mother has big breasts, if the mother has had a C-section delivery, if the mother has had a normal delivery. When is the side-lying hold recommended? I'm getting multiple answers. Let's see. Okay. Yeah. Let's see what is the correct answer to this question. The correct answer is C. If the mother has had a C-section delivery, she may be having problems in attempting the different other folds like the cradle fold or the C fold. The most comfortable hold will be the side-lying hold for breastfeeding as recommended, as you can see here, right? So because of the C-section, this position is most comfortable for the mother to breastfeed her child, right? Okay. In sideline hold for breastfeeding, the mother should hold her breast in which shape? From the side in a C-shaped fold, from underneath in a U-shaped fold, from underneath in a scissor-shaped fold, from the top in a U-shaped fold. Okay, let's see what is the correct answer to this question. I got multiple answers, but the correct answer is from the side in a C-shaped hold. Here you can see this is the C-shaped hold. From the side, the mother can hold her breast in a C-shaped hold, and that will be the most comfortable thing to do while side-lying hold for breastfeeding, right? It is a C-shaped hold from a side, not U-shape, not scissor shape from underneath as well, right? Okay. If the mother is tired and has back pain, which breastfeeding hold is recommended? Cradle hold, cross cradle hold, football hold, or laid back hold? Okay, let's see what is the correct answer to this question. It was a very general answer. It is the laid back hold. Here you can see if the mother is tired or having back pain, the laid back hold will give a support to the back of the mother, and it will be a very comfortable position for breastfeeding as well. Right? Okay. Move to the next question. Which babies should not be breastfed during the COVID-19 pandemic? Babies born to mothers with suspected or confirmed COVID 19, babies with suspected or confirmed COVID 19, babies with symptoms of COVID 19, or all babies should be breastfed according to the standard infant feeding guidelines. Yes, yes, because some questions were exactly the same as the previous year assigned, previous week question which we had already discussed. That's why I've not included them. I already told when I started the class that some questions I have deleted because it was exactly same as the question we discussed in week 6. So I have not included them. That's why the numbering can be a little bit different. Okay? Yeah, that's not a problem. Yeah. Okay, let's see what is the correct answer to this question. Correct answer is D. All babies should be breastfed according to the standard infant feeding guidelines. Okay? Okay. We'll move to the next question. For how long should the mother wash her hands before and after touching the baby? 1 minute, 30 seconds, 20 seconds, or 10 seconds? Whoever is joining late, please cope up with whatever question is going on. Later, you can attend the lecture, attend these sessions, like receive the recorded sessions from the YouTube channel as well, right? Again, I'm getting multiple answers. Let's see what is the correct answer. Okay, let's see what is the correct answer. correct answer is 20 seconds. 20 seconds of washing of hands by the mother is enough before and after touching the baby. Not 1 minute. 1 minute is enough. Not it's like too much. 20 seconds is enough. Okay. Should the mother wash her breasts before breastfeeding? Yes, every time, never, only if she has been coughing on her chest twice a day. Okay, let's see what is the correct answer to this question. Correct answer is C. Only if she has been coughing on her chest, the mother needs to wash her breast for breastfeeding because it can be contagious if she has been coughing on her chest, right? Okay. If a COVID 19 infected mother is too unwell to breastfeed, what should be done? Immediately start giving formula to the baby. Immediately start animal milk. Try feeding expressed breast milk to of the mother to the baby. Start giving complementary food. Okay, let's see what is the correct answer to this question. The correct answer is C. Try feeding expressed breast milk of the mother to the baby. So, what is expressed breast milk? The pump. The pump we use to flow out the baby's milk, breast milk, if the mother is COVID 19 infected and is too unwell to feed the baby, then they use this baby pump to pull out the milk so that the baby can get the mother's milk only. If the baby is under 6 months, you can't start giving formula milk immediately or animal milk or complementary food at all. The baby needs mother's milk only, right? And if the mother is unfit to breastfeed directly, they can use this expressed breast milk method to give to feed the baby, right? Okay. When does skin to skin contact be started if the mother is COVID 19 affected? After the mother tests negative for COVID 19, immediately after birth, when the mother does not show symptoms, or 3 days after birth. Okay, let's see what is the correct answer to this question. The correct answer is B. Immediately after birth. Even if the mother is COVID-19 infected, there is no problem in skin to skin contact, and the baby needs skin contact immediately after birth, as in any normal condition, right? Okay. The mother should express milk at least every dash hours, including during the night. 3 to 4 hours, 2 to 3 hours, 1 to 2 hours, or 4 to 5 hours. Okay, let's see what is the correct answer. The correct answer is B. I think maximum people have given the correct answer. 2 to 3 hours, at least every 2 to 3 hours, the mother should express milk, including during the night. Right? Okay, to build up mother's milk supply, and if it seems to be decreasing after a few weeks, she should express breast milk every dash hours immediately after breastfeeding the baby. 1 to 2 hours, 2 to 3 hours, 3 to 4 hours, or 4 to 5 hours. Read the question properly and then answer. It is not same as the first question, as the previous question. Okay, let's see what is the correct answer. A. 1 to 2 hours, right? So if the mother's milk supply has decreased over the few weeks, she should pump out her breast milk every 1 to 2 hours after breastfeeding the baby, keep the milk, right? And also to increase the milk supply again. Okay. To relieve symptoms such as engorgement or leaking of breast milk at work, the mother should express 200 ml of breast milk, 100 ml of breast milk, 1 drop of breast milk, or only as much as is necessary. Okay, let's see what is the correct answer. The correct answer is D. Only as much as is necessary is enough for to relieve symptoms such as engorgement or leaking of the breast milk at birth. Right? When are nipple shields recommended? When mothers have flat or inverted nipples, when mothers have a big areola, when mothers have a big nipple, when mothers have big breasts. Okay, let's see what is the correct answer. The correct answer is A. When mothers have flat or inverted nipples, it may not be enough for the baby to suck it and it may lead to nipple feeding instead of breastfeeding. That's why nipple shields are recommended for mothers who have flat or inverted nipples, right? So, what is a nipple shield? It is almost like a second nipple. It goes over your breast and nipple and has tiny holes in it so that the milk can be transferred from the nipple to your baby's mouth, and it helps the infants with trouble latching onto the breast by acting like a longer, firmer nipple, right? Okay. Mother should store the breast milk containers in the dash of the fridge. This is the coldest area of the fridge. Back of the lowest shelf, topmost shelf, door, or middle shelf. Okay, let's see what is the correct answer. Correct answer is A. Back of the lowest shelf is the coldest area of the fridge and it is recommended to store breast milk containers there. Okay, breast milk can be stored for up to dash days in a fridge under clean conditions. 7 days, 5 days, 15 days, or 2 days. Okay, let's see what is the correct answer. Correct answer is 7 days. Up to 7 days, you can store your breast milk in fridge under clean conditions, right? Germs do not start growing in fresh breast milk for at least dash hours, even in a hot climate and outside the fridge. We now know that we can store breast milk for 7 days at least in fridge, but if it is kept outside or in hot conditions, for how many hours can the breast milk stay fresh? 1 hour, 3 hours, 6 hours, or 12 hours? Okay, let's see what is the correct answer. The correct answer is C, 6 hours. Okay, till 6 hours, the fresh breast milk can be kept outside in hot climate and germs won't grow, but after that, it may start growing, so we should be careful about that, right? Breast milk, which is frozen solid in a separate freezer, will be good for 3 to 6 months, 2 to 4 months, 1 to 2 months, or 1 month. Okay, let's see what is the correct answer to this question. The correct answer is A, 3 to 6 months. If you have kept your breast milk frozen solid in a freezer, in a separate freezer, it will be good for 3 to 6 months to be used. Right? So the next question comes, when using frozen breast milk, ideally defrost it by keeping it for dash on the lowest shelf of the fridge. 6 hours, overnight, 10 hours, or 2 hours. So now you have, if you are using frozen breast milk, you have to defrost it. So what is the ideal time you need to defrost your frozen milk at the lower shelf of the fridge, not at room temperature, right? So time, think and answer. Done? Okay, let's see what is the correct answer. The correct answer is overnight. So if you have kept frozen breast milk Mano for 3 to 6 months, when you want to defrost it, at least you should keep for overnight on the lowest shelf of the fridge, not at room temperature, not in heat environment, right? Okay. Nipple shields dash the baby's time spent resting during breastfeeding. Increase or decrease? Yes, yes. I think everyone has given the correct answer. It will increase. Nipple shields, as they are artificial nipples which act as nipples but are not actually nipples, they may increase the baby's time spent resting during breastfeeding and not actually breastfeeding, right? That is the demerit of nipple shields. Feeding with a dash is a good for the first few days after birth because during these days only a small amount of milk is needed. Spoon, paladai, small cup, nifty cup. Okay, let's see what is the correct answer. Correct answer is spoon. For the first few days, feeding with the breast milk with a spoon is also enough for the baby as it is a very small amount of milk is needed for the baby and it will increase with time, right? Okay. Sore or cracked nipples is a condition where nipples become wet and shiny, itchy and dry, soft or hard. Sore or cracked nipples is a condition where nipples become wet and shiny, itchy and dry, soft or hard. Yes. The correct answer is B. Itchy and dry, right? So, a dry, sore, or irritated cracked nipple can often happen during breastfeeding. Some of the symptoms are soreness, crusting, oozing out, or bleeding of the nipple tissue as well. So, what are the remedies for these sore or cracked nipples? There are some gels available at the pharmacy, that is like purified lanolin or hydrogel dressing can soothe cracked nipples and help them retain their moisture back. If the nipple is becoming infected because of these conditions, antibiotics may help as well, right? Okay. Dash hormone which helps the breast milk to come out. Prolactin, oxytocin, aldosterone, growth hormone. We have already discussed this question. Just the framing of the question is different this time. Yes, the correct answer is oxytocin, right? Because that that is the let down reflex, right? Due to which the breast milk comes out and that function is done by oxytocin, right? Okay. It is dash for the mother to have a protruded nipple for the baby to attach deeply. Necessary? Not necessary. Okay. So the correct answer is not necessary. It is not necessary that the mother should have a protruded nipple. Protruded nipple means the hard and stiff nipple for the baby to attach deeply. Without the hardness and stiffness of the nipple, also the baby will attach deeply, right? Massaging mother's neck and upper back will help the breast milk to come out. True or false? This question also we have discussed. Again, you people can answer it. Yes, the correct answer is true, right? We have already discussed this. Next question is, when a mother may ask about using a nipple shield, it is important to first ask her about her breastfeeding technique and problems, her breast and nipple size, her budget for nipple shields, size of her areola. Right? Start answering. Yes, yes. Her breastfeeding technique and problems. When a mother may ask out for using a nipple shield, it is important to ask her about her breastfeeding technique and problems and why she would need a nipple shield, right? Okay. Dash is a behavior that happens in the early hours of life in which the baby naturally attaches to the mother's breast or something else. Imprinting or outprinting. The correct answer is imprinting, right? So, what is imprinting exactly? Imprinting is the first emotional or neurobehavioral development shown by the baby in the first early hours of the baby towards the mother, or whatever it sees first during the few hours, whatever it experiences in the first early hour of its birth, that experience is called as imprinting. As it stays imprinted in its brain, that behavior stays imprinted. So if in the early hours of the baby is breastfed by the mother, that behavior will be imprinted in its brain for a long time, right? Okay. Dash from squeezing of the nipple and areola by nipple shields is common. Nipple growth or nipple injury. Sorry, this is nipple injury, not A, it's B. Everyone has given the correct answer. Nipple injury from squeezing of the nipple and areola by nipple shields is common, right? Okay, we'll move on to the next question. I think this is the last question of this session. The baby might swallow too much dash because of the nipple shield. Hind milk, fore milk, air, or water. Done? The correct answer is air. So if mother is using a nipple shield, there is very high probability that the baby might be swallowing just air too much instead of milk, right? So that should be taken care of while using a nipple shield. Okay. With this, we are finally at the end of our discussion for this week's assignment questions. Does anyone have any doubts regarding any of the questions? They can ask, or we can disperse. The session is recorded. I'll upload it in the YouTube channel. Whoever has missed it can go back and watch and revise the questions again. Right? Is there any doubts which I need to clear? Okay, I guess no one has any doubts. Then we'll end the discussion today. We'll meet again on next Tuesday with next week's assignment questions. Till then, keep attending the lectures, keep reading about the course, and keep practicing questions. And yes, okay, we'll disperse now. Yes, yes, yes. Okay, I, yeah, okay. Thank you, everyone. Okay, link of YouTube. I think I've given before. Let me check once. You people can get the link of the. Sorry, I forgot to ask marks. I thought maybe we discussed a lot of questions, so you people may not have tracked down how many correct questions. Go green. Really nice. 44 is a good score. Anyone else who wants to share their scores? You're most welcome. Did anyone else track the wrong and correct questions? 42. That's a good score. 44. Okay. So 44 is the highest today. Okay. Okay. 44. And yeah, I think the YouTube session links, all the PPT links, PPT folder links, it is available on the NPTEL website. You people can go and check. I think it is there, right? From there you can get the link. Okay? Okay. Yeah, it is there. So whoever doesn't have it, they can go and search it. Yeah, Shruti has uh, already sent the link. So whoever wants, they can do. I think I've not uploaded last week's session. I was a little busy. I'll do it today, this week's session as well as the last week's session. Okay? Okay. Thank you everyone for your patience. We'll meet again on next Tuesday. Okay? Okay. 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 Bye bye. Thank you.